it's just a huge honor for me today to be podcast interviewing Jonathan Abenaim, all the way from Hawthorne, New Jersey. He is the owner of Jonathan Dental Spa and the Smile Syllabus Institute in Hawthorne, New Jersey. Dr. Abenaim graduated from the University of Pennsylvania and did advanced implant prosthetic residency at Nova Southeastern University and Atlantic Coast Dental Research Clinic in Palm Beach, Florida. He is in the top 5% of elite cosmetic dentists in the United States to execute both surgical and cosmetic portions of dental implant dentistry. He's also a clinical instructor at NYU in the Department of Implant Dentistry. He is passionate about staying current and progressive in modern dentistry. With his passion, skill, and love of both learning and teaching, he opened the Smile Syllabus Institute in 2016 and is educating leaders in dentistry with continued education. Out of the office, he likes to spend most of his time with his 4 beautiful children and wonderful wife. We both have 4 children. So how old are your children? What ages?
One of the things I have to say is it has to be 4 beautiful children and 1 beautiful wife, because I don't want to get in trouble too.
Okay, well, I can't say 1 beautiful wife. That my boy's mother fired me after 20 years, but my boys are 22, 24, 26, 28.
Oh, wow. Mine is 11, 10, 7, 4.
And mine are all boys. Did you get all the same, or 2 of each? Or
I'm good at controlling, so girl, boy, girl, boy.
Well played. Ryan was supposed to be a girl. That's the only reason we tried to have a 3rd one. He let me down right out of the gate. And then his little brother, Zach, he let me down. So finally, we threw in the towel. Hey, I called you to be on this show. You didn't call me because you wrote this book, The Trust Factor, Empowering Your Team, Your Patients, and Your Dental Practice. And I always said, I've written books that writing a book, I mean, it's like having a baby. It's a 9-month process. What was going on in your life and your journey where, especially after having 4 children, that you decided you were going to sit down and write a book?
So actually, the book was written not just by me, but with my team members, because I really felt that I wanted to have a book that finally can be written and read by the whole team in the person's point of view. So my hygienist wrote some chapters, my treatment coordinator wrote some chapters, my assistant wrote some chapters, and I wrote some chapters. So I had a lot of great help to do that. But what I really wanted was, the main reason I wrote the book is based on my journey and my evolution about how we do dentistry and how we speak to patients and how we do everything. We really felt that we wanted to be able to give that out to the world. But most importantly, whenever we added a team member, the hardest thing was to teach them our culture. And now we basically have our book, and it's like a manual. They read it. This is what we believe in. You believe in it. You work here. You don't believe in it. Next. 10 years ago, I saw a great interview from an office in Arizona, and they interviewed the team, and the team said, I was looking to work at Today's Dental, and I couldn't believe that they were interviewing, and I was so excited, and I think it's an honor for me to work here. And I'll never forget that. I saw that 10 or 11 years ago, and I said, that's what I need to build. So thank you for that, Howard.
Ah, thanks, buddy. So you have 2 websites. What is the difference between JonathanDentalSpa.com and SmileSyllabus.com, and which one should my homies go to? JonathanDentalSpa.com or SmileSyllabus.com, and which one of those would have your book for sale on it?
Yeah, so my Jonathan Dental Spa is my practice website. If they want to be my patient, they can go there. If they want to learn about our digital syllabus, about our courses based off of the book, that's SmileSyllabus.com. We have everything that we have there. In terms of buying the book, just go on Amazon. It's sold there. And I would definitely urge them to follow me on Smile Syllabus Institute on Facebook. We update that every single day with whether it's digital dentistry, new workflows, whether it's things that can do in the office. And every morning I actually do a 10-minute conversation in my car on the way to work with another dentist, and we call it Dentists in Cars. They can check that out also on iTunes.
So it's on iTunes, so it's a podcast.
I don't like to call it a podcast. I call it a conversation. It's 10 minutes or less.
Well, you know what? The best marketing for a podcast, the only reason I started the podcast is because we started Dentaltown in 98, And then I did an online CE course in 2004 and kicked off that. But we started a podcast section, and now there's 39 dentists uploading a podcast or an audio file, whatever. But look at the views on some of these. Like, this guy started a podcast, How to Open a Dental Office, and he's at 674,684 views. So I think if you started uploading that, what do you call it, in cars or conversations in cars?
We call it dentists in cars.
That is so cool. I love it. Dentists in cars. But yeah, I think everybody who's put their podcasts on the Dentaltown, they said their iTunes exploded. That's where a lot of people found these shows.
Definitely.
So that'd be a huge honor if you started doing that. So, but back to your patient website, I just want to say congratulations on that, because on the Jonathan Dental Spa, you know, whenever a dentist emails me, howard@dentaltown.com, a lot of times I click their website to see who I'm talking to, you know, just to look at it. And I'll tell you, 80% of the websites it looks like they bought them at a convention 5, 10, 20 years ago, and they haven't done anything with it. And what I like the most about yours, and what I think is the most effective, is you have YouTube videos on there. So if I was a consumer and I was living in the great state of New Jersey, I just think it's really cool to be able to see the dentist himself talking with patients, and they get to see who it is. And you almost, like, what percent of dental websites do you think actually have a YouTube video of the dentist talking like a human?
Who even knows? I mean, probably very, very little. I mean, one of the things we've started doing is, which is tremendous and really cool, is we now Facebook Live in the chair with the patient, with the conversation, to show the patient's emotion, the way the patient is experiencing, to see that it's not that hard. And, you know, the truth is, people have been saying it for years. We don't treat teeth, we treat people. Today, it's more than ever. So we don't even show teeth. We just show people's reactions, the way people are treated, the way that people are spoken to. And that's tremendous. You know, I'm not showing that me creating an osteotomy at 1400 RPM with saline flying in and making a hole in your mandible. Nobody wants to see that. They want to see the vision of what we created for the patient and how they feel after that.
So what do you think, what does it mean when someone like yourself says, welcome to Smiles by Jonathan at Jonathan Dental Spa? What really is a dental spa? And what do you think a dental spa is? But more importantly, what does the consumer think when they see a dental spa? What is that?
So when I started my practice 10 years ago, that was in the I would say maybe the infancy or the pinnacle of a lot of people doing a lot of different things for their practice, whether it's like aromatherapy, paraffin waxes, massage chairs, massage in the foot massage in the chair in the office, 3D glasses during dentistry, all that fun stuff. And I came out of the gate, I got all this stuff, and I landed in New Jersey. I'm ready to rock and roll. And everybody says to me, no, man, I don't have time for that. No, it's okay. Just get it done. Just get it done. Just get it done. And what happens is that our practice evolved from Jonathan Dental Spa to really Smiles by Jonathan, which is what we create every single day. But the problem is I had built up the brand of Jonathan Dental Spa. I'd be killing myself if I just got rid of my name. So what we do now is we added Smiles by Jonathan at the Jonathan Dental Spa about a year and a half ago, and slowly we're going to actually transition out a dental spa.
So you have something very interesting on your jonathandentalspa.com website. You said you have an article, Pink by Jonathan, a breakthrough technique, a scalpel-free, suture-free procedure for correcting gum recession involves laser biostimulation, stem cells, and gum rejuvenation. Gingival recession, also known as gum recession, can be corrected without cutting or stitching. The affected areas are treated using stem cells and collagen to help speed up healing and reduce infection. There is no cutting or stitching. Patients can expect minimal postoperative symptoms of pain, swelling, and bleeding. Patients at our dentist's office are pleasantly surprised by the instant cosmetic improvement. So when did you get into that, and how do you do that, and what's that all about?
So my practice, 80% of my practice it's surgically oriented. I do the surgical portion of implant dentistry and the restorative portion based on my experience. We mill our own zirconia restorations. We use intraoral scanners to create all this fun stuff. And because of my surgical experience, wound healing is wound healing. We all know that right now there's a very, very hot course called Pinhole surgical technique. So I took a course with Dr. Chow, Pinhole surgical technique, and Dr. Chow's technique is unbelievable. It works really, really well. But I knew that I could, because of my surgical background, I could make that technique even better and more predictable. And I was doing a lot of PRF in my practice for my surgical sites for whenever I was doing any flaps or anything like that. So I said, you know what? I'm going to put PRF inside that hole. So I created what's called Pink by Jonathan, where not only do we put the bio guide that's with the original technique, but then we go ahead and we put some stem cells to allow the flap to not move. And then on top of that, one of the things I learned with my implant surgery is that I wanted my patients to heal better. Whenever we had an infection, we used to use a laser with an Nd:YAG laser with laser biostimulation. So we put everything together, whether it's the PRF, the bio guide, and the laser biostimulation, and I call that Pink by Jonathan because I've never seen anybody, especially on PST, Pinhole Surgical Technique forums, that's ever done that. I was the first one that posted to do that, so I put that together and called it Pink by Jonathan.
Very, very interesting. Of course, my job is to guesstimate what all my homies are. 85% of these guys are commuting to work right now, and I think podcasts massively took off. We started 2 years ago, so the first year was during the year-long election. Everybody got so sick of radio they didn't want to hear about it anymore. So they're all commuting to work and they're listening to podcasts instead of radio. But I know what they're thinking. They're saying, well, first of all, which your implant training, where do you learn how to get implants? What system did you learn? We just had 6,000 kids graduate from dental school last week, and they're all coming out saying, Jonathan, I didn't place one implant in dental school. How do I go from I've never placed one to one? How do I go from 0 to 1? Do I have to pick the implant first? Do I pick the training?
So it's a really wonderful question. A great friend of mine, his name is Paul Goodman. He said to me, Jonathan, a dental implant is a monster post and core. So that being said, when a student will say to me, I teach at the university, so I teach implant surgery, and when they say, well, I've never placed an implant, I said, well, think of it this way: it's a big post and core with a bigger screw. The difference is that there's now a surgical component attached to it. So if somebody wants to learn implant dentistry, we know that implant dentistry is a prosthetic discipline with a surgical component. So the first thing I would say to them is restore these cases. Work with your lab, work with your surgeon to start restoring these cases. Once you mastered the restorations, then you start taking teeth out. And now when you take teeth out, start doing some bone grafts. Don't charge so much. Get your suturing technique under control. Someone is not going to teach you in 9 months everything you know about implant dentistry. I just got my boards in the American Board of Oral Implantology, and I hope they're not listening to this. They may be. But I took the exam I didn't even study for the test. I just went to it. And I was glad I didn't study. I passed, by the way, the written and the oral. I was glad I didn't study for it because you cannot teach experience. You need to see these things. It's not in a book. So it's all about the numbers. The more that you do, the better you're going to be. So start doing a lot of extractions, start doing a lot of bone grafts, then do the single implant. Learn the system, pick a system that you like, learn the parts, the same way that a salesman who's not a dentist knows exactly what speed to go out, how to hold the drill, what part goes into what part. That's okay. That you can learn. It's very easy. But the prosthetics and the surgical components of treatment planning, that you have to go and spend some time. Find yourself a mentor, take a course, but it's a lifelong learning. You cannot stop. What I did 10 years ago, I do not do today. It's just completely different. And probably what I do today, I won't do in 6 months, just because, especially with the way that I do digital technology today, like today I took a full upper arch with a full intraoral scanner, and we're designing the restoration right now in-house, and we're going to put it in the machine tonight, and it's going to mill. And by tomorrow we come in, we have a full arch bridge ready to give the patient. So
is that an all-on-4, a full arch bridge?
So for me, we don't do all on 4 because if you lose one, it's all on none. We place as many as we possibly can. We don't charge the patient. We charge per case fee. And I talk a lot about this in my book, about not penny pinching your patients, really treating them like people. Yeah, the trust factor, and really allowing them to be treated like people the same way that you would want to place. So if a patient trusts you to do their reconstruction, you better make sure it works. If you think you can make it work with 4 implants, do it with 4. I personally think I need as many as I can because people smoke. A lot of people are on antidepressants. There's a lot of osteoporotic drugs. There's a lot of rheumatoid arthritis drugs. And those implants, we are going to have an epidemic in 10 to 15 years of all the implants that were placed. Peri-implantitis is a real thing because of medical history. So if you don't over-engineer your case, you're going to be in a lot of trouble in a couple of years.
That was some of my biggest regrets from 30 years ago. I'd place 2 implants and do a 3-unit bridge. And then 20 years later, I'm in the nursing home standing at her chair side with my assistant. One of the implants failed, and Jan and I are thinking, why didn't we just put 3 implants there? Then you could have lost one of the implants and you'd still have the bridge. What scanner, so they're asking in their car, what scanner do you use? What miller do you use?
Yeah, so that's a wonderful question. In my course, I give a 2-day digital dentistry course that goes over from milling, scanning, printing, everything, all the workflows that we created. And people that don't do digital dentistry, that's what they ask, because dentists are like that. They assume that they can buy a piece of equipment, bypass all the education, plug it in, and make it work, just like what burr, what loops. Digital dentistry is about learning, understanding the technology, and then it doesn't matter what mill you have. It doesn't matter what scanner you have. They're all the same as long as you understand the technology. And in terms of the mill, we are all taught about CEREC, and we say we're CAD-CAM dentists. But let me tell you, people that use CEREC are not CAD-CAM dentists because they don't do any CAM. It's hidden. Sirona, it's closed. CAD, it's minimal. There's so little they can do. A single crown, a bridge, that's it. But in real digital dentistry, you can do so many different things. Like I'm creating something called the Jonathan solution, which is for patients that can't afford full zirconia bridges. What we're doing is we're now designing fiberglass bars with long-term PMMA on top of that, and we deliver that to the patient. The lab cost is tremendously low. The patient has a fixed restoration, and there's no more dentures. And now they can pay for dentures and still get a fixed restoration, not mini implants, real size implants, real long-term. We use digital dentistry to help us do that. So what mill, what scan, I would say come to my course, let me teach it to you, and then you'll know exactly what the right questions are to ask.
So your courses are at smilesyllabus.com.
Correct.
And your courses are generally, what are they generally? 2 days? Talk about your course. You have.
So my course is 2 days. It's full 16 hours. The people that have said to me that when they left, even after day 1, that they had a knowledge headache. They felt inspired. They now see what is possible. And tremendous, it inspires people to do more for their patients because there's so much that you can do. Dentistry all of a sudden is so much more fun. Like, I can't believe it's 6:30 right now. I have not stopped all day, and I don't feel tired because it feels amazing to do this. So we give a 2-day course, which really that 2-day course can be a 2-week course. But we pack it all in because I want every single person that comes in to get exactly what they wanted out of the course. I am tired. I was tired of going to courses, getting people to sell me things, and I never got what I wanted out of it. So my commitment is that when you come, and you have a realistic expectation of what you're going to learn, you will get it when you leave.
So you would basically, to get to Hawthorne, you fly into Newark, right?
Yeah, flying to Newark. There's a Hyatt hotel 7 minutes away. Newark is 20 minutes from my office. It's a beautiful little town called Hawthorne. There's gorgeous restaurants around. It's 20 minutes from New York City. The courses are usually Thursday, Friday. People stay with the weekends with their family, and it's gorgeous. We have food, we laugh, we really have a great time. We don't hold back. I'm not sponsored by anybody, so I tell you the truth of what is going on. If I tell you something is broken and it doesn't work, you'll know it's broken. I'm not going to lie. Nobody censors my slides. And again, I get a lot of slack for it. I have, the big companies calling me and telling me to stop it, stop talking, stop doing this. But I'm an advocate for the dentist. I am there fighting for you guys so that nobody takes your money. Nobody tells you to buy something you're never going to need, and that 100-pound paperweight will never be in the corner again, based on my what I'm going to present to you to do.
So you were born in Montreal, Canada, right?
Yeah, Montreal, Canada.
So do you ever give like a French version of the course? Do you ever have like a French only course?
I actually don't get to go back too much.
You should go to Paris and give this lecture in French.
Well, I just came back from London. And I think London is probably a little bit more dangerous than Paris, not because of what's been going on lately, but because of the way they drive. I think I almost got run over a couple times because I didn't know to look right and left. I just looked one side, and I was always going the wrong way.
I couldn't even imagine driving in any of those countries where they drive on the wrong side of the street.
I wasn't even driving. I just tried to cross the street, and I had a hard time.
Right, because your instincts, you're looking the wrong way. It's crazy. So I think I mean, you don't need marketing, but I think the best marketing that I've seen people do for this course is when they have a 2-day course, they put a 1-hour online CE course on Dentaltown, because it's a big jump for my homies, especially if they're young and have student loans, to go from a flyer to flying all the way to Newark. But man, I wish I've seen dentists where they'll put like the Pinky Institute does it. They'll put an hour course showing what, kind of a highlights of week 1, and then another course they did 4 1-hour courses, 1-hour course showing what each week was about. And of course, I just want to get some amazing guy like you to put an online C course on Dentaltown. Also, I think I would love to get articles on this. I mean, if you ever want to write an article for Dentaltown magazine, because this is what everybody's questioning. But you said something I want to drill down on it farther. Were you, when someone says they're a CAD/CAM dentist, are you kind of saying that the CEREC machine is just a small piece of it, mostly single crown replacement, and you're doing it more? Because you notice the labs, they don't mill one crown at a time. They mill big disc. I mean, is that what you're saying? That kind of CEREC CAD/CAM is kind of an entry level, one tooth at a time, and you're doing full roundhouse bridges, and that's not really a solution you're going to do with a CEREC machine?
Well, let's talk about that. So, do you remember easy bake ovens?
I had 5 sisters, so yes, that was one of my favorite pieces of technology ever invented.
All right. So the easy bake oven, very well, had a halogen light bulb, correct?
Right.
All right. It had one button and only one recipe to put in.
Chocolate.
Every time you clicked it, you knew exactly what you were going to get, correct?
Right.
But if you decided you wanted to make a fondue, if you decided you wanted to make a croissant, you wanted to make all this gorgeous bake stuff, could you use the easy bake oven?
No.
No. You'd have to actually be a little bit more grown up. You agree?
Right.
And actually use a real oven. So for me, CEREC is a single one-trick pony Emax single unit crown. That's it. So when somebody says to me, I mill, I scan, I design, I'm a CAD/CAM dentist, it's actually a marketing lie that was told to them. You're not a CAD/CAM dentist because you don't understand CAM, you don't understand CAD, and you don't understand acquisition, because there's so much more to that. Now, let's look at the new game. The new game in town is you can buy the scanner that's best there for you. You have the ability to buy design software that allows you to design night guards, allows you to design temporaries, allows you to design bars, allows you to design single unit crowns, allows you to design custom abutments. And let's talk about the economics of things, Howard. A puck, a zirconia puck, costs anywhere between $100 and $160. Out of one puck, you can mill a minimum of 30 single unit crowns. And this is the best zirconia in the world. Did you just do the math?
Yes.
Insane. So for somebody that says to me, oh, I'm a CEREC dentist, I'm like, well, enjoy paying $50 a block for a material that's subpar than zirconia. We have the ability today, I'm doing testing in my office where we're doing zirconia and I'm holding it side to side to full contour, not layered, none of that stuff. Full contour zirconia next to Emax. It is not a comparison. The zirconia blows it away by unbelievable in terms of aesthetics, and we get triple the amount of strength. So why not?
So if you're driving to work, it's hard to take notes. I just went to Amazon.com and looked up his book, The Trust Factor, and then I forwarded it out on Twitter. So if you follow me at Howard Fran, I just retweeted The Trust Factor, empowering your team, your patients, and your dental practice on Amazon. So I know my homies, Jonathan, I really do. I know what they're saying. They're saying, yeah, but I don't think any of this applies to me because I'm in Parsons, Kansas, and you're talking about this big fancy dentistry, and or they're thinking, where the hell do you get these patients? Or is Hawthorne a miniature Beverly Hills? I'm in a blue collar middle class America. What island is Jonathan on? What would you say to all those self-limiting beliefs?
Look up Hawthorne, New Jersey. You will see that I practice in an old school Italian town, blue collar to the max, unbelievably nice people that work for every penny they have. Again, I once watched this unbelievable DVD 10 years ago, and this person said, dentists, they want to be high-end dentists, and they go for that 2% of the people. Who's taking care of the other 98%? And that resonated with me, Howard, because that was you. All right? And you said, I want to be the guy that takes care of the 98% of people. I don't take care of the top 2%. My patients work really hard. They all use financing. They all use care credit. A lot of them have co-signers. And it's something that, because of the methods that we talk about in the book, we really get into why they need this. And we tell them there's a reason that you got in the car today to get this done. And you know what? When a patient is waiting 4 months for his implant to heal, a patient come in, we did a digital scan on him, no cost, no impressions. I designed the crown in under 5 minutes. I milled it in 15 minutes. It's sitting in the oven tonight. Tomorrow when I wake up, I'm going to deliver my zirconia restoration. It's going to cost me less than $20. So if you practice in Kansas, why would you not want to do this? Because you're going to be the guy who people give to. Remember, you don't need that many patients. If you have 1,500 patients and each patient only does 2 cleanings a year and maybe 1 filling, each patient is about $1,000. That's $1.5 million practice. You don't even have to try. You don't have to go for that 2%. You don't have to be a full arch dentist. But guess what? It's when I tell people that say to me, doctor, I'm 67 years old. I don't want to spend any money on my mouth. So I always say to them, if you were going to live only 2 more years, would you want those years to be the best years of your life so that you have the ability to eat whatever you want, smile as best as you want? But in 2 years, the clock just takes off. That's what I tell to dentists. If you're only going to practice for 5 more years, would you want those 5 years to be the best 5 years of your life? Or would you want to suffer through packing cord, impressions that get lost on FedEx, labs that call you and tell you that your impression is poor, or crowns that don't fit? Why would you not want the rest of the time that you practice to be fun, predictable, and amazing?
That's amazing that you said Hawthorne, New Jersey was an Italian community, because one of my best buddies and role models, Gary Isolde, we actually went to undergrad together at Creighton University, and we were roommates in Creighton Hall. And Isolde, I assume, that's Italian. Anything that ends in Isolde, right? Anything that ends in an I is probably Italian, right?
Yeah.
And man, what a great guy, Gary. I hope you're listening, man. Thanks for all the fun. So if you go to smilesyllabus.com, there's a lot of information. You can order the book, you can register. What else are my homies going to find on smilesyllabus.com?
I think my favorite section on top of there is the videos, which is snippets of my lecture. And they could just see what it's all about. You talked about the online. You could see all the people that have been there, all the people that have experienced it. You can listen to I've hosted leaders from all over the world, and these are not regular guys that come. I've had some regular people that come, and they love it. And then we have the experts that come, and they can't believe that there's something that they don't know. So it's for everyone, because it makes dentistry super, super fun. So I love the videos. And then the thing that's really where I'm super excited about is in December, we're going to be having our first course for the whole team. It's limited to 7 teams, where you come, the dentist, the hygienist, the assistant, and the treatment coordinator. And we're going to have a 2-day course about how we do what we do. Not in terms of dentistry, but the way that we treat our patients, the way the forms are filled out, the way the new patient exam is, the way the hygienist speaks to the patient about something that they see, we have something in the book called the Trust Handoff. We have all these different things that we talk about. And here's the thing, you may be the best dentist in the world, but if people can't listen to you and they can't trust you, it doesn't matter who you are. Somebody once said to me, Jonathan, you could be Michelangelo, but if you don't have a canvas, nobody will ever know. and your patient is your canvas, they don't allow you to paint on them, it's over.
You know, I do. I love your videos. I watch all your patient testimonials on Jonathan Dental Spa, but that was the one I mean, it really is. It's a very amazing stuff. My question is, when I watch your videos, to me, my first gut feeling was that you had a dental laboratory background, that you grew up in a lab. I mean, because it looks like you're really mastering the laboratory side of this. It's almost like, where did you learn all these skills? Did you work closely with the lab? How did you find and learn all this stuff?
It's so easy, Howard. It's dentistry. We're all dentists. And CAD/CAM technology just makes it so much easier for us to So no, let me tell you something. I did my first online dental school. I had to do it 10 times on a dental form that I threw it across the room, and I swear I would never walk into a lab again. But let me tell you something. When I mill a zirconia restoration and I sit there, right, just for even 15 minutes, I can put my headphones on, right, early in the morning or late at night or on my day off, where I could just put on my headphones and sit and paint. It's zen, Howard. My kids, I take them to Color Me Mine or pottery, and I spend $150 for them to paint. I'm now getting paid to paint. Why would I not want to do that? It's so much fun. I'm not telling you to do full arch reconstruction. The laboratory is so important, but there's so much that we can do for our patients, that we can provide treatment and change the way dentistry has always been thought of, that why wouldn't we? Why would we be stuck in the way that we were before? My mission statement that I wrote when I was in dental school is, I want to change the way people look at dentists.
That is a hell of a goal.
It's not easy. And I also want my new Smile Syllabus goal is, I want to change the way that corporate companies treat dentists. I can't tell you how many times I'm sitting in a stall pissing, listening to reps talk about dentists. And the way they talk about us, there's no respect. Zero. And we work so hard for our money that they just, I'm going to get this guy for this much. I'm going to get this guy for that much. He can afford it. He has this car. He has that car. Well, we all worked really, really hard for what we have.
So again, so you talked about, we're trying to focus on the 30 and under club. You've talked about implants. You gave a lot of advice on CAD/CAM. Another question they have is lasers. What are your thoughts on lasers?
So I was a diode laser guy for I don't know, 12 years in practice, 11 years. And I haven't packed cord since I left dental school. That was one of the things that when I went into pros, I was like, there's no way I'm going to go into pros if I have to pack cord. Because imagine prepping 30 teeth and packing cord on each tooth. It just wouldn't work for me. You know, and when the back one moved, I'm like, oh my God, that's like an extra 45-minute appointment. So when I found a diode laser to trough around the margins with no recession, it was like godsend to me. I knew that there was something else with lasers out there that I'm like, these laser dentists, they love it. So I had a rep come into my office. I met with all the companies, and one rep just resonated with me, what he said. And the fact that his laser was so powerful, I don't use a diode laser anymore, which for me is just a hot paper clip after I use this type of laser. I use a laser that has a combination of an Nd:YAG and an erbium laser. So it's a hard tissue and a soft tissue laser. And you could do so many things. You can do cosmetics with it. You can do, when I mean cosmetics, I'm talking about lips. You can do sleep apnea in terms of getting rid of snoring. You can do biostimulation. You can do, obviously, the regular stuff that we talk about, perio, class 1 occlusal composites, troughing around teeth is so much fun now. I can actually feel the tissue. There's just so much that can be done with lasers. I actually happen to use a laser. I don't know if it's important to say. Is it important to say the type of laser that I use?
Yes, absolutely. Please say it.
Yeah, so I use a Photona Lightwalker, which is a dermatological company that makes medical lasers, and they made the exact same laser that gets used 24 hours a day by doctors for dentists. It's unbelievable. So it's a Photona Lightwalker. I love that laser. It's built like a rock. I kick it around, I throw it around, and it just doesn't break. And it's wonderful.
And how much is Photona Lightwalker?
I'm not sure. I think it's anywhere between $50,000 and $70,000. I'm not really sure, but one of my favorite things that I use my Photona laser for is crown removals on bonded teeth. So cool without breaking the crown. I love that.
Really? Talk about how you do that.
So, so I once had a case, patient, it's one of my cases that I show in my digital dentistry course. Patient came in, zirconia restoration. We put it in. The lab totally screwed me. I put it in and I started adjusting everything. And the guy was so excited. He was so happy about it. I took some pictures and then I went home and I looked at the pictures. I'm like, this is an embarrassment to society. I cannot have this person walk around. I sent the exact same case with the impressions and everything back to another lab, and I got new crowns taken. Now the patient comes back for his 2-week post-op, and I have to tell him that his new crowns that he loves, I'm now going to cut them off in zirconia. Can you imagine what a shit show that would be? So I take out my laser, we go on an erbium setting, and we shoot energy between the zirconia crown and the tooth, and it debonds the cement without breaking the crown in case my new case wasn't going to work. So if you ever have a case where you need to reuse the crown, you have the ability to take the crown off without doing anything. So thank God I was able to put the new ones in, but I didn't want to destroy the ones that he loved. So I remember that. It's great.
Now, do you do endo also?
Haven't done endo since dental school.
So help these young kids. I'm going to throw a rant at you and tell me what you think. In 1900, you just had a doctor and they did the whole body head to toe. And healthcare was only 1% of the GDP. By the end of the century, 2000, there were 58 specialties and healthcare was 14% of GDP, and dentists had 9 specialties. Now at 2017, healthcare is 17%. So I guess when the point I'm trying to say is this: some dentists try to almost want to go back to 1901, where they're going to do everything. Do you think a kid can really do everything? Place implants, do endo, do sleep apnea, do ortho, do restorative, be a cosmetic dentist, or do you think that's not going to happen? I mean, there's so much to learn. Like in the United States, there are 40,000 journals each month that go to physicians, dentists, MDs. I mean, you can almost barely stay up on one thing. So when these kids come out of school, give them some parenting advice. I mean, because sometimes the kids start talking to me and I think, well, this is scary. They name every single thing and they're going to do it all. And I'm like, do you think this is 1917 or 2017?
I think that firstly, the kids coming out of school today are as arrogant as ever. Okay, they think that they know everything. I mean, I was arrogant when I got out of school, but I see, maybe it's because I'm getting older, but they're as arrogant as, because they do not understand that when you screw up, this is not a class. This is real life. So when I tell people, and it's not associated just with the GP, it's associated with the specialist too. So I'll get back to the GP in a second, but the specialist, I get a phone call from somebody, he's an orthodontist, he just graduated from residency, and he's asking me about buying an ortho practice in Hawthorne, New Jersey. So I said to him, I said, that's great, you just graduated ortho. He's like, yeah, I went to ortho school, I know how to do the cases. I said, let me ask you a question. What do you know about running an orthodontic practice? He's like, well, actually, I don't know anything. I'm like, do you know how to bill for it? No, I don't really know how to bill for it. Do you know how to hire people? Not really. Do you know where to buy a new chair? It's like, no, I don't really. And the questions about what we go through every single day that we have to find the answers for was just, no, I don't know. So I said to him, find a mentor. Find somebody that's going to teach you how to be a dentist. Because guess what? Just because you have 3 letters after your name, you're so far from being a dentist, you don't even know. So even if you're a specialist, get somebody, learn. Even if it's somebody that you don't look up to, you'll learn what you don't want to do. So you just do the totally opposite. But if you're lucky enough to find someone that does what you want to do, then you copy him. It's in terms of GPs, yes, it's so open. It's amazing. It really feeds the millennial ADD. Because you can do so many things in dentistry and there's more and more. But for a GP, when I tell them, I'm like, sit down, buy yourself a macchiato, Sit in Starbucks, put some really nice music, take a blank piece of paper, and write your vision for yourself in the next 5 years. Whether it's procedures, whether you want to be personally, where do you want to be professionally, where do you want to live, how long do you want to work? Get those answers all down before you think you're going to do endo, sleep apnea, implant dentistry, restorative dentistry, oral surgery, bone grafting, periodontics. There's too much. Go slow, because if you go head in first, you may really drown so fast because you'll never be able to enjoy the fruits of labor of dentistry, because dentistry is so much fun today. It really is. Like, I don't even know what's like. I can't imagine. I'm like, I can't wait to get to work, because it's not work. I get to change people's lives, and I work with unbelievable people every day. It's fun. It really is. And the mistake that you can do is either A, be stuck in something that you never want to do, and because you don't have a vision. Stephen Covey said it 1,000,000 years ago. Begin with the end in mind. Dentists are not immune to that. Begin with the end in mind. Because if you don't have a vision, you have nowhere to go. You don't know where to start.
Well, I want to walk you into a dark area because of what you just said, having fun. It is a very common thread on Dentaltown where dentists, especially in their 40s, maybe 50s, will say, I'm just going to be honest. I'm burned out. I'm tired of this game, but I got a family and I'm a dentist. It's not like you can go make this kind of money working at the Waffle House. What would you say to a burned out dentist at 45 and said, Jonathan, I'm just fried? And you're saying it's fun and I'm fried. What would you say to that guy?
One of the things I learned is that it starts from the top. If you yourself keep telling yourself, I'm burnt out, I hate my job, I hate going there, you know what happens? Every single day, you're surrounded by people that hate their job even more because they don't make the money you make. So imagine being in a toxic environment like that. The first thing you have to do is change your mindset. If you want to be miserable the rest of your life, the only person that's ever going to be able to help you is yourself. You need to make a change for yourself to say, hey, and that I talked about in my book. I kept losing patients left and right, employees left and right. I was like this, I was being successful, but it was not fun. Before I went on a vacation, boom, I lost an employee. My vacation was destroyed. And I said to myself, I always said, it's the lab, it's the employee, it's the dental chair, it's the handpiece, it's the burr. The last person I ever blamed myself was me. So look deep inside of you and see what is wrong that you're doing that's not making you happy, and change it. Don't keep going down that road that makes you unhappy. And guess what? If dentistry does not make you happy, then don't do it anymore. Don't do it. Go do something else. Go buy a hot dog cart. Go do something that makes you fun. Go be a consultant. There's a ton of, I got an email from a DSO who wants me to be their clinical director, $600,000 a year, $1.2 million in equity. That doesn't make me happy. Money doesn't make, people that search for money for happiness will never be happy. Success is not defined by how much money you have. Success is by the way you affect people, the way that you make a difference in the world. Do that. People that are multi-billionaires, Bill Gates, Mark Zuckerberg, they are giving away all their fortune because they've realized that it's so much better to give than to take. It's as simple, for me, it's just logical. So if you want to be burnt out, you want to complain, you want to say you're always tired, you want to say I can't, it's never going to change. But if you really make a conscious effort to say, I need to be better for myself, do something that you enjoy. Pick one thing that you enjoy, that you look forward to it. You know, in the summer, my wife goes away to upstate New York. I hated going to upstate New York. But when I go to upstate New York, my phone service sucks. It allows me to just be zen, to get away. And I look forward that whole week. That's what I look forward to doing. My family's away. I can't wait to see them on Thursday night. I'm dead tired. Luckily, I drive a Tesla. My car drives by itself. It gets me there, right? But look forward to something that you love. Being burnt out is just an excuse. And for me, I once heard somebody say, an excuse is just a well-planned lie.
So do you drive up to the Finger Lakes area up north? Is that where you go?
I go to Catskill Mountains, Monticello, New York.
Man, I love the Finger Lakes out there. But what you said, you were saying you blamed it on everybody but yourself. My favorite Michael Jackson song was always "Man in the Mirror." It's the Man in the Mirror. And right now, and I'm sure your favorite song, you're from New Jersey, so I'm positive your favorite song is either from Bruce Springsteen or Bon Jovi. Did I get it right?
Close.
And which one of those two? Which one of those two is number one? If you had to pick between Bruce and Bon Jovi.
Bon Jovi all day.
Bon Jovi all day. But but seriously, they're saying, well, it's all been ruined already. There's nothing I do. The whole market's been taken over by PPOs and corporate dentistry. You don't understand. Times are different than it was 30 years ago. What would you say to a dentist who says, I'm being threatened by PPOs and corporate dentistry?
The only person that's threatening you is yourself. Here's what one of the theories that we have is that we live in abundance, and when you live in scarcity, your patient sees it. So when you are like, oh my God, I got to grab this, I got to grab that. When you have the mindset that there's one pizza pie, there's 8 slices, and when more people, more DSOs, more corporate comes in and makes my slice smaller and smaller and smaller, you live in scarcity. I don't believe that. I believe that there's millions and millions of pies. I went to a symposium this weekend, and the statistic is that by 2020, it's right around the corner, there's going to be 61 million patients that will need full arch implant dentistry. So for you to tell me that corporate is taking that away from me, you don't need all 61 million of them. Hell, give me 100,000 of them. I'll be good to go. There's so many patients. People are being born every day. Every single day. You didn't fix all their mouth. 50% of patients don't have a dentist. There's so much. One of the things this weekend did for me is to realize there's so much opportunity. There's so many pizza pies out there. I just got to find them. And I don't need all of them. That's why my course, all this stuff that I do, my trust factor, my digital dentistry, I don't make money giving courses, Howard. I make money doing practice. I do this because I want to leave a legacy for myself and share with people. If I could inspire somebody to help another patient, that's part of my world. That makes me happy. So when somebody texts me, he's like, man, I just did this case and I'm so excited because of what you taught me. Thank you so much. That feels the best. That's the best feeling in the world. I can't charge enough to do that. I can get paid enough. So don't change your mindset. Nobody's taking your the guy who when you say corporate dentistry, I'm scared about corporate dentistry because the guy who just graduated, who corporate dentistry hired, is better than me. That's a joke. He or she can never be better than you. You've been doing this for how old is this doctor? 40, 50?
That's funny. Until you said the word joke, I heard no Canadian accent out of your mouth. But when you said joke, that was total Canadian. I wonder whether. Yeah, I'm on the Centers for Disease Control website right now, cdc.gov, and I mean they're saying right now that 27% of Americans between 20 and 44 have a cavity right now. So 1 in 4 Americans are walking around with a cavity, and there's 325 million Americans. They're saying that 38% of Americans between 18 and 65 didn't even see a dentist one time last year. I mean, that's basically 40%. So if 1 in 4 adults are walking around with a cavity and 40% didn't even go to the dentist last year, there's a lot of upside in every community from Kansas to Hawthorne to LA.
It's unbelievable. The opportunity is huge. Remember what I told you. You don't need to be a fancy dentist. 1,500 patients, $1,000 each, $1.5 million a year, a cavity and 2 cleanings.
So you've talked a lot about clinical dentistry. What about business? I want to switch to business for a minute. If you we've surveyed dentists on Dentaltown.com every month since 1998, and for 20 years, if you lined up 100 dentists, said what stresses you out the most, what keeps you up at night the most, it's always staff. It's staff. What advice would you give to a dentist who's sitting there saying, my assistant fights with my hygienist, I'm afraid, I know that every time the earth goes around the sun, they all come in the office and want another dollar raise. It's all based on the zodiac. My overhead goes up every year. I tell them that they still want to raise. They just have the hardest time with HR. What advice would you give them with HR?
First things first, I'm all about the definitions. So for me, the staff is an infection. So if you have staff working with you, or working for you, get rid of them. First thing you got to do is you have to have a team that works with you. If you have a team that works for you, they will always ask for more money. So first things first, you have to set the definition and the culture in your practice. That's the first thing. Second thing is, again, you have to look at yourself. Are you making your office a safe place to be? Are you making them realize that this is their place? They're not just spit suckers. They're not just gum gardeners, but they have a bigger role in the way that the whole machine works. Are you empowering them to realize that what they're doing is making a difference? People don't leave practices. I've interviewed so many people, and they never leave because of the money. They always leave because of the way they're not appreciated. In terms of the way that people are fighting together, when I gave my course in London last month, I met this unbelievable Romanian dentist. He practices in London, but he's moving back to Romania. He has an office in Romania that's 3 floors. They have general dentistry or implant dentistry, pediatrics, and on the top is a full dental lab. They're medical tourism. They have Americans fly in and get their work done. He has 54 employees in one office. Okay, not multiple, one office, 54 employees. He said to me, Jonathan, I found the secret sauce. He says, in order for a practice to be successful, it's about the way the team gets together. I said, yeah, of course we know that. If they're unhappy, they don't do that. So he says, you know what I did? He said, once a month, I created Happy Wednesdays. What the hell do you mean Happy Wednesdays? He says, once a month, I put €500 together, and they choose something that they do together. And they create a bond together that they want to be there every day. And when they want to be there every day, the office just works so much better because they want to help each other. So I am actually excited. My first Happy Wednesday is this Wednesday. We're doing the escape room, which I so recommend to anyone. Have you ever done that, Howard?
An escape room? No.
So the escape room is so unbelievable. It's something that you get to, how we think we know, we understand our team members. Oh, well, this is what this person does. This is what this person does. You need to see them in a situation. What it is you're locked in a room and there are clues. You have 60 minutes to find the key. And you see, you have to have a puzzle together. So the person that has the analytic mind that likes to do things with their hands the way that they think, they're going to take that task. The one who's great at reading between the lines, who would be like your treatment coordinator, who understands what the patient is really saying to them when they're not saying it to them, you see her in action. You see them out of their element, and all of a sudden you get to see what they really are all about. And you're working. The only way to get out of that room is if you work together. We did that about 2 years ago. It was the most fun we've ever had. And I saw things in my team members. Some of them just sat in the corner because they didn't feel great in certain situations because of their personality. So you know what to put. Don't give them a task in the office that they don't enjoy doing, they don't like doing, or they're not good at doing it. So that's one of the things. Make your place safe. Make it empower them. Show them that they're making a difference. And again, change your mindset. Change the culture. The culture should be for your patients. I have a chapter on the culture for the way your patients come in, that it should be a privilege. They should know that it's a privilege to be treated here. So, I mean, I could go on for hours.
No, I wish you go on for hours. I never heard of the escape room, and I Googled it while you were talking, and there's 3 in Phoenix. There's one in Phoenix, Gilbert. Is this a new deal?
It's like a franchise. They have them all over the place. It's freaking awesome.
Yeah, team is and then I want to ask you, I only get you for 3 more minutes, and again, this has just been so amazing, and I'm salivating and drooling that you're gonna write us an article for Dentaltown magazine, or at least put some online CE up. A lot of them also, they almost think they'll solve all their problems with marketing, and so they're always asking. So I know what a good chunk of them are thinking. Well, how are you getting all these patients? Are you in Facebook ads, direct mail? You got a billboard? Because if I just had 10 more new patients a month who wanted all this expensive dentistry, it'd solve all my problems. So do you think a big part of your success is because you're a very successful marketer and get a high new patient flow?
No, not at all. The phones ring. It's all about your team. Do they know how to answer the phone? Are they saying, Jonathan Dental Spa, please hold? Are they really dedicating the time to listen to that new patient, that shopper that everybody's, oh, he's just shopping around? Do they really spend time? Because the patient that's going to spend $30 to $70 to $100,000 in one day, that's a special person. If you treat them like the Days Inn or Motel 6, they're not coming to you. But if you show them that you're going to be there for them, this is the place to be, it's safe, they see that your team members feel safe, they see that your team members are excited to be here, you have to do nothing. I don't do anything. I just do the dentistry. It took me years to realize that. I thought it was like today. We did a great interview today with 3D BioCAD about milling systems and chewing. We're going to post that on the internet soon. And I had my hygienist who came back and decided she wanted to be my personal assistant. She gave birth. She has a new baby. She couldn't work the full time here. She decided she's not going to be a hygienist just so that she could be here. She took a pay cut. And she's like my personal assistant now. She does whatever I do. So I was looking at the video and she's editing. I'm like, oh, she's like, don't micromanage me. I could do this. And I said, you're right. I need to walk away and let you do it. Innately, as dentists, we think that by being on top of people, we're actually helping them. But really, we're blocking them. We're blocking them to do what they do great. And she finished the video and I had a chance to post it because of everything I was doing today. It was so much fun. I mean, I printed this morning, I milled this morning, I took digital impressions this morning, I did a bunch of implant surgeries. It was so much fun. It was fun. I don't even know how much money I made. Doesn't even matter. I'm trying to check my day sheet.
Well, wait, we want to hear.
I'm not going to tell you how much I made. Are you insane?
Did you already check?
I already checked.
Yeah, but it seems like a lot more money to you because you were born and raised on Canadian dollars, so... was that a good one?
I took the loan for my practice in Canadian dollars, and then I got crushed during the payback period when the Canadian dollar and the American dollar was equal. So I had to percent more.
Well, seriously, I can't believe we did an hour. That was an unbelievable fast hour. But I want to tell you another thing. I'm a huge fan. You have 2,670 posts on Dentaltown. I can't tell you how many times when I'm talking to townies and I'll say, what do you like about Dentaltown? So many times people have called you out by name saying, man, the people that post on there, your posts in particular, I mean, 2,670 posts. I mean, you're like in the top 5% of posters because most dentists are afraid to say anything because someone might disagree with them or say they're wrong. And to show a case, and that's another question I've been asked about people like you who have posted several thousand times. They say, well, you must have really thick skin. Because what if you post a case and someone says you should have done it this way or that way or done this or that? So for you to post 2,670 times on Dentaltown, would you say you just have thick skin and what trollers are going to be trollers or what is it about your psyche where you have the balls to post work in front of 250,000 dentists around the world?
The number one reason that I would post my case, whether it's on my Facebook, whether it's on Dentaltown, is not so that I could get responses like, hey, John, that was amazing. Wow, John, that was great. John, you're a great dentist. It's for the troller to tell me, asshole, you should have done this way. And it gets me thinking, like, maybe I should have done it better that way. Maybe there is a better way to do it. Like Dentaltown I was in dental school when I started on Dentaltown. Okay, 2001, I started dental school. I was a dental student, and I was on dental school. I was probably the first dental student then. And I remember, I even posted my dental school classes. You need to understand, Dentaltown wasn't created. I remember Howard saying, it's for the first time the solo practitioner is no more practicing on his own. Remember when you said that?
Yes.
No more, ever. And that's the thing. If you want to be surrounded by yesers, you'll never be great. You need to be surrounded by people that push you, whether it's your team, whether it's your family, whether it's your friends. You don't want to be surrounded by people that are logs that just say yes, 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 because you'll never be great. You'll be stuck where you are. I want to be uncomfortable being comfortable because that makes me push to do even more. Never be comfortable being comfortable because then you're going to be plateaued and that's how you burn out. If you're comfortable being comfortable, you need to look in the mirror really quick because it's going to go downhill so fast you're not going to be able to stop it.
Well, hey, do me a favor. If you ever see my roommate from Creighton University, Gary Isolde, around, tell him that his bald buddy Howard from Phoenix, Arizona says hi. My God, I love listening to you. I could listen to you for 40 days and 40 nights. I want to thank you for so much world-class, amazing content you've posted throughout the years on Dentaltown, and just thank you for having the hunger and the work ethic and the hustle and the natural curiosity to go figure out the next level of CAD CAM, from the easy bake oven to the chef's fillet, everything you're doing. I mean, I think what you're doing is just world class, and it was a huge honor that you would come on the show today and talk to my homies. Do you think my homies can expect an hour-long online course someday that kind of summarizes what they would learn if they went to your 2-day courses?
I've been waiting for that invitation for 10 years.
Okay. All right. Well, thanks again. Thank you so much for all that you do for Dentaltown and dentistry.
All right. Thank you so much, Howard.